Welcome to Do It For Me Insurance's Medicare Basics 2026 edition. This is our annual presentation in which we talk about Medicare from start to finish, as well as discuss some of the changes that have been implemented for 2025 and for 2026. So let's get started. Who I am. My name is Joe Covell. I'm the principal of Do It For Me Insurance, licensed and independent insurance broker since 2012, assisting individuals and businesses with informed insurance choices. Former broker, manager, and trainer for 200 plus independent brokers at Custom Benefit Plans, Inc. from November 1st of 2011 up until 5/31 of 2025. I have been continuously helping insurance carrier executives to enhance product lines. Diverse experience in multiple markets. I'm a graduate of Penridge High School and Temple University. Our agenda is Medicare defined parts and coverage, original Medicare, Medicare Advantage, prescription drug plans, Medigap, otherwise known as Medicare supplement policies, the enrollment periods, starting the process, and questions you might have. What is Medicare? Medicare is a federal health insurance program in the United States. It provides coverage for individuals who meet certain eligibility criteria. Who is eligible for Medicare? People age 65 and older, people under 65 with certain disabilities, including end-stage renal disease and ALS. People who have worked and paid Medicare taxes for a certain amount of time, usually at least 10 years, 40 quarters. For more detailed information, please visit medicare.gov. What is a Medicare beneficiary? A person who is eligible for Medicare is known as a Medicare beneficiary. This term can be confusing to consumers when enrolling in Medicare plans and policies. When ready to finalize, qualified consumers should sign where applicable for a Medicare beneficiary to sign. The four parts of Medicare. Original Medicare consists of Part A, which is related to your hospital expenses, Part B, which is related to your doctor and outpatient expenses. This is the part that comes from the government. This is original Medicare, or also called traditional Medicare. Medicare Part C and Part D are privatized. Part D is standalone prescription drug coverage. Part C is Medicare Advantage, which actually takes the place of A and B, and a majority of the time includes Part D in it. To debunk some confusion, when a consumer says, I want A, B, C, and D, it's usually either I have A and B with D, or I have C, which may or may not include D, and we'll get into that a little later. Original Medicare, Part A covers hospital care, skilled nursing facility care, nursing home care, hospice, home health services. Part B covers doctors and other provider services, ambulance services, durable medical equipment, mental health, limited outpatient prescription drugs. Medicare Part A is premium free for most taxpayers. If you paid Medicare taxes for less than 30 quarters, the standard Part A premium is $565. This is the 2026 numbers. If you paid Medicare taxes for 30 to 39 quarters, the standard Part A premium is $311. Medicare Part B. Medicare Part B has a monthly premium everyone must pay. Most people in 2026 will pay $200.90 a month. As per the Income-Related Monthly Adjustment Amount, IRMAA, which is a federal government legislation, surcharges will apply for some. Original Medicare other costs. Part A. Inpatient hospital deductible is $1,736. Daily copayment, formerly called daily coinsurance, for days 61 to 90 is $434. Daily coinsurance for lifetime reserve days is $868. Skilled nursing facility coinsurance is $217. The Part B deductible will rise to $283 from where it is now at $257. Immunosuppressive drug premium is $121.60. Part B IRMAA explained further. This is a chart that tells you how much your Part B premium will be based on your tax filing from a 2-year look back. So basically, what your tax filing was in 2024 will dictate the premium you pay now. So for most people, that's going to be $202.90. The next threshold is $284.10, depending if you file single or if you file as a married couple. The next threshold being $405.80, then $527.50, $649.20, and the highest it can be is $689.90. For immunosuppressive drug coverage only, the premiums, again, are $121.60, $202.70, $324.30, $445.90, $567.50, $608.10. Not only does it affect your Part B, it also affects your Part D. Those under the limit above here will pay nothing extra. So basically what happens here is you buy yourself a Part D or a Part C plan, and then the government tells the carrier in which you selected to charge you these additional amounts in and above what the premium of the Part D or Part C is. You could pay $0, you could pay $14.50, you could pay $37.50, you could pay $60.40, you could pay $83.30, and you could pay $91, depending on what your income was from 2 years prior. This is enforced by either the Part C or Part D carrier that you select. If you go without it, there's penalties enforced, which we'll get into later as well. What if you're married filing separate? These are the limits for that. For $109 or less, married filing separate, it's $202.90. The next threshold is $649.20, and then $689.90. The same for immunosuppressive drug coverage. $121.60 is the standard. Then it jumps to $567.50, and then $608.10, depending on the filing. And married filing separate in terms of Part D, $0 added, and then right to $83.30, and then right up to $91. What is immunosuppressive drug coverage? Immunosuppressants, otherwise known as anti-rejection drugs, are drugs or medications that lower the body's ability to reject a transplanted organ. If a Medicare beneficiary qualifies for Medicare due only to end-stage renal disease, the coverage generally ends 36 months after a kidney transplant. As of January 1st of 2023, there is a new benefit to continue to pay for immunosuppressive drugs after 36 months, if there is no other health coverage. Only the drugs will be covered and no other items or services. For more on this coverage and end-stage renal disease, refer to medicare.gov/basics/end-stage renal disease with the hyphens in there as well. I'll give you a second to jot that down, or you can pause it and resume. The final two parts of Medicare: Medicare Advantage Part C and Medicare Prescription Drug Coverage Part D. Part C, Medicare Advantage. Government-sponsored option to receive benefits of Medicare A and B through private health plans. Essentially, what's going on here is you're surrendering Medicare A and B back to the government, which is going to pay a private insurance company to administer Part C, which is supposed to give you benefits similar to that of A and B. The easiest way to think about this is to say, if the federal government is speaking to you and says, I'm not good at being your insurance company, I'm going to give Blue Cross, Humana, Aetna, whatever company you pick, I'm going to give them roughly $850 every single month, and they're going to take the place of Medicare. And on the side of the insurance company, collecting that $850 a month, they have to make it so you are no worse off than if you just had A and B of Medicare. This will help pay for your out-of-pocket costs under Part A and B. Many plans include Part D prescription coverage. Many plans include additional benefits such as vision, hearing, wellness services, dental, over-the-counter allowances, gym membership, healthy foods, and more. Must be enrolled in Parts A and B. You are going to pay for Part B even though you technically do not have it. You still have to keep, maintain, and pay for your Part B. Most plans have defined networks such as HMO, PPO, private fee-for-service, HMO, point of service, etc. That contrasted to Medicare. Medicare does not have a network. It is a non-network. You can go to any doctor in the country who takes Medicare. They will accept you. There's no pre-authorization at this time. There's no referrals needed. There's no gatekeeper. So that's the biggest difference between original Medicare and a Medicare Advantage plan. With a Medicare Advantage plan, the reason why the government wants to give this money to the carriers is because, in theory, the carriers are going to do a much better job of facilitating fraud. That's not to say that your average person is frauding Medicare, but there's lots of bad actors out there that ring up all kinds of bills, and Medicare really does not have the muscle to police this. the way that the insurance carriers do what is their job to facilitate claims. As a consumer, we can debate your experience on each, but that is fundamentally the difference between original Medicare and a Medicare Advantage plan. Part D prescription drug coverage must be purchased in addition to Medicare A and B. So this is another privatized part of Medicare. Offered by private Medicare approved insurance plans, the national premium for 2026 is $38.99. This is going to matter when we factor in fines. Higher income enrollees pay a higher price for Part B and Part D as per the federally defined income-related monthly adjustment amount, IRMAA, surcharges. Part D, the 3 coverage levels. Now, this has changed in recent years thanks to the Inflation Reduction Act. There is no more donut hole that used to really plague a lot of people. So phase 1, you will pay until you reach your deductible. In 2026, the maximum a deductible can be is $600.15. Phase 2, your Part D insurance pays until $2,100 in total Part D drug spending is reached. This factors in other variables too, such as having LIS, which is extra help through Social Security, or maybe a state program. In Pennsylvania, we have PACE and PACENet. In New Jersey, they have PAD. The total spending of the meds, once it reaches $2,100, again, when they first wrote this bill, it was $2,000, and now they've raised it another $100. Once the total spending of the meds, what you, the beneficiary, and the insurance company or extra help is paying, reaches $2,100, you are done spending for that calendar year. I have to tell you, though, that is drugs that are covered on the formulary. If the drug is not on the formulary, you are completely out of pocket for that. Phase 3, after the $2,100 is met, you pay $0 for covered brand and generic medications for the rest of the year. And phase 4, no more stage 4, deductible, initial coverage, and catastrophic coverage. In the past, once you met the first threshold, you would pay a percentage until you met the second threshold, and then you would pay a small amount. Now, $2,100 is the stop, as long as the drugs are on the formulary. What changed in 2025? The Inflation Reduction Act of 2022 included several provisions that will lower Medicare Part D costs, lower prescription drug costs, $35 a month cap on insulin, $2,100 year cap on out-of-pocket costs on 2026 plans, negotiated drug prices, limited price increases to inflation beginning in 2025, expanded access to preventative care, cancer screenings and vaccinations, financial assistance for lower income beneficiaries, expanded eligibility for low income subsidies, LIS, otherwise known as extra help, increased LIS financial assistance. What changed in 2025? Potential for skyrocketing Part D premiums. Drug manufacturers required to pay rebates to the government if prices for certain drugs increase faster than inflation. Drug manufacturers may increase prices for other drugs to offset the cost of the rebates. $2,100 cap for covered drugs. Beneficiaries who use a lot of expensive drugs may have higher Part D premiums. Medicare Prescription Payment Plan, known as M3P, allows Medicare Part D enrollees to pay monthly for drug costs. If you have a super expensive drug, say it's $700 the first month because you have a deductible and the drugs are tier 3 or tier 4, instead of paying that amount up front, you have the option to break it into payments throughout the year, and that is administered through your insurance company. If you do not make these payments, they will not cancel your insurance. They will stop the payment program usually. And this is open to all Medicare drug plan holders, no enrollment costs. Limits out-of-pocket drug expenses to $2,100. Ideal for those with high drug expenses, especially if enrolled before September. Register via your plan's website or customer service. Options like Extra Help and Medicare Savings Programs are available for low-income individuals. Visit Medicare.gov or call 1-800-MEDICARE for details. Help with drug costs. Medicare offers a program known as Extra Help for those with limited income and financial resources. The program is often referred to as LIS, meaning low income subsidy, and can help pay for Part D plan premiums, deductibles, coinsurance, and copayments. It can also pay for Part D late enrollment penalties. Generally, individuals with an income limit of $23,475 and a resource limit of $16,590. For married couples with an income limit of $31,725 and a resource limit of $31,100 can qualify for LIS extra help. Pricing varies based on income level. For more details and to apply, refer to, and this link below here. And the asterisk is income limits projected based on estimate 2026 federal poverty guidelines. CMS will release official LIS income thresholds once 2026 FPL is finalized. So the resource limits have been posted, but the income limits have not at the time of making this. How did the Inflation Reduction Act affect LIS? The new prescription drug law, i.e. the Inflation Reduction Act, will help those who qualify for extra help program even more. In 2024, it began everyone who qualified for extra help, LIS, will pay $0 Medicare drug plan, $0 plan deductible, reduced amounts of $5.10 for generic, and $12.65 for brand name drugs. Partial LIS was phased out on 1/1 of 2024, meaning the full LIS program will be available to all individuals with incomes up to 150% of the poverty level, 135 to 150%, 223 partial LIS level. What are considered resources for LIS? Money in a checking account, savings, or retirement account, stocks and bonds. What are not considered resources for LIS? Your home, one car, burial plots, and up to $1,500 if set aside for burial costs. Furniture and other household and personal items. Here's how you can apply, or you can also call Medicare or Social Security. Help with drug costs continue. In addition to LIS extra help, many states offer state-run programs to assist with high drug costs. To see what's available, refer to this link here. When becoming eligible for Medicare, often manufactured coupons and programs can become void. A helpful resource to determine if a pharmaceutical assistance program is available, refer to this tool on the Medicare.gov website. You may also explore services such as GoodRx, Medigap plans, also known as Medicare supplement policies, sold by private companies. Fill in the gaps of original Medicare. Example, Medicare Part B generally pays only 80% of the bill. Medigap policies help cover the portion for which you are responsible. You must be enrolled in Part A and B to enroll in a supplement policy. Medigap policies are standardized. All policies offer the same basic benefits, but some offer additional benefits. And they do not have, since 2006 when Part D was enacted, they do not have drug coverage anymore. They cannot. I would like to add, there's lots of plans that are grandfathered that did have drug coverage, and those plans still require Part D because most times that coverage does not meet Medicare's definition of credible drug coverage. Generally, Medigap policies don't cover long-term care like a nursing home, vision, dental, hearing aids, private duty nursing, or prescription drugs. Some Medigap policies cover travel outside of the U.S. Usually it's very limited, like $50,000 lifetime. Great option for people who are currently receiving or seeking ongoing medical treatment. I like to think as Medicare supplements almost like life insurance. You can buy it anytime, you can change it anytime, but it's based on your health, and we'll get into that later. So why I say it's a lot like life insurance is if you're healthy, it's a bill that you have and you don't really quite understand the value of it, but when you use it, you are very happy that you had it, if you can afford it. Everyone's needs and budgets are different. Medicare supplement open enrollment period. Best time to buy a Medicare supplement policy. Must be enrolled in Medicare Part B and Part A. If you don't sign up for a Medicare supplement policy during this open enrollment period, you may not in the future be eligible to enroll unless you have a guaranteed issue right. You may be required to answer medical questions. You have your birth month and 5 months after to buy as many Medicare policies that you want. I mean, you can keep changing it every single day. After that 6-month period, any and all changes, even if it's an upgrade or a downgrade with the current company, in most states is going to require medical underwriting. There are a few states like New York where they don't ever ask medical underwriting. Guaranteed issue rights. Right now, especially in the Philadelphia region, there are a lot of Medicare Advantage plans that are canceling. Our local Blue Cross here has terminated 50,000 PPO plans, and Highmark Blue Cross Blue Shield in the Pennsylvania, New York, Delaware, and West Virginia territory has canceled roughly 160,000 plans or has changed them drastically to the point that they need to be re-enrolled. Nationally speaking, United Healthcare has roughly 600,000 members that will not have a Medicare Advantage plan. They can get another Medicare Advantage plan, and that's why it's been so hectic this year, is helping people decide. But they also get a guaranteed issue. The letter comes from the carrier that tells them their rights. And that by law requires that they can get a Medicare supplement. Now, they are regulated to certain plans that they can take. And it all has to do with when your Part A was effective. If your Part A was effective prior to 1/1 of 2020, your guaranteed issue plan by law, by every company that they have to offer you is Plan F as in Frank. If it's after that date, then Plan G is the guaranteed issue. Now, there are certain companies, United Healthcare being one, that allow you to have different letters. But generally speaking, when your Part A was effective dictates as to which is available to you guaranteed for a certain amount of time. This chart right here talks about the different types of Medicare supplements. Plan G and Plan N being the most popular ones. Plan G covers everything except for this little X here, which is the Part B deductible, which we went over earlier. For 2026, that is going to $283. Simply put, you pay the first $283, and then you don't have another copay or cost for anything covered by Medicare for the rest of that calendar year. On Plan N, you pay that deductible, and then you go to a copay model of no more than $20 per doctor visit and no more for $50 per ER. Specialists are considered doctors, and why I say no more than 20 is because sometimes doctors don't charge it at all, but it was not to exceed $20. The other hole you see down there is called Part B excess charges. If the doctor is not content with the reimbursement of Medicare and wants to charge an additional 15%, which can vary by state, they're able to do so. 98% of doctors in America do not charge it at all. It is very rare. And when you come across it, you could simply ask a doctor if he or she charges an excess charge. The Plan G covers that. Plan N does not. That is really the only big difference between G and N. Often is the case if you look at the cost difference, it usually works out that you would have to go to the doctor 2 to 3 times every single month or even an ER visit, not to save money on G versus N. Enrollment periods. The 7-month window that straddles your 65th birthday. 3 months prior, your birth month, and 3 months after. This involves Part D and Medicare Advantage plans. Medicare Supplement open enrollment period, which as we discussed, is your birth month and 5 months after. The general enrollment period and open enrollment period, January 1st to March 31st of each year. This time period was for those, and still is, for those who did not sign up for Medicare Part B when they were supposed to. This is the time period that they can do that. If there was not credible coverage, there is Part B late penalties of 10% per year, and there's also Part D penalties, which we'll get into later. During this time period, some years ago, it was expanded. If you had a Medicare Advantage plan and wanted to make one additional change, meaning you had buyer's remorse or something of that nature, you can make a one-time switch during that time period. Right now, we are in what's called the annual enrollment period, which is going to end on December 7th. During this time, anyone could buy a Part D or an Advantage plan that has Medicare A and B. The next enrollment period, the January 1st to March 31st, is for those who have a Medicare Advantage plan to make a like-to-like plan change, or to also buy yourself a Part D plan to return to original Medicare and see if you qualify for supplements. Both of those can be achieved during this upcoming time period next. And again, October 15th to December 7th every year is the annual enrollment period. What is the initial enrollment period? This is when you enroll in Parts A and B, enroll in a prescription drug plan, enroll in a Medicare Advantage plan. If you don't sign up for Medicare Parts A and B or Part D when you are first eligible, you could face penalties that raise the price of your monthly premiums. The general enrollment period. You may also sign up for Part A and or Part B between January 1st and March 31st each year if both of these conditions apply. You did not sign up when you were first eligible. You are not eligible for a special enrollment period. Your coverage will start the first of the next month from the enrollment. It used to be you would enroll during this time period and your coverage would start July 1st. Now it's the first of the preceding month. You can have February 1st, March 1st, or April 1st. Depending on when you sign up. The annual enrollment period, you can make changes and enroll in a Medicare plan from October 15th to December 7th. This does not affect Medicare supplements. Medicare supplements cannot be changed during this time period. Again, like life insurance, you can buy them any time of year, but it's based on your health. That is the most important thing to understand about Medicare supplements, because a lot of people say, oh, I'm healthy now, I don't really need that supplement. It's not about now, it's about the future, and that should go into your decision making. The fact that you cannot always get these, not to say it's a fear of missing out, but that is what is still keeping roughly half of the country in a Medicare supplement, is they're afraid to get rid of it in case what happens in the future. If you have original Medicare, you can switch to a Medicare Advantage plan or vice versa. You can switch from a Medicare Advantage plan with drug coverage to one without, or vice versa. You can join or drop a Medicare prescription drug plan. You can also update your coverage by switching to a new plan from your current insurer or from a new insurer. If you choose to make a change during the annual enrollment period, your new coverage will begin January 1st. The open enrollment period, or as we said, the general election period, is January 1st to March 31st. And is for those people enrolled in a Medicare Advantage plan can make a once per year switch to another Medicare Advantage plan. The OEP cannot be freely advertised the way the AEP can, but plans and brokers may inform consumers when the consumer inquires. They can't run TV ads talking about the open enrollment period, but a broker or a plan can tell you about it. Medicare Advantage plan enrollees can also disenroll from Part C and return to original Medicare A and B, as well as enroll in a standalone Part D drug plan. Medicare supplements are not guaranteed, though. Again, cannot enforce this enough. What is a Medicare Advantage trial right? Medicare supplements, Medigap, offer a free look period of 30 days for Medicare beneficiaries to decide if they wish to keep the policy or not, whereas Medicare Advantage plans offer a trial right in specific circumstances. If a Medicare beneficiary drops original Medicare and a Medigap policy to enroll in a Medicare Advantage plan for the first time, they have a 12-month period to change their mind and return to the previous policy if it's still available. If the company left the market, then you get a guaranteed issue to buy someone else. This is important to note too. You can't just go to any plan. You literally have to return to the plan you left if it's still there. We had instances like this company Lumico, where they were not offering the plan anymore, and that gave a guaranteed issue to go buy somebody else. If the previous policy is not available, they can buy another Medigap policy with another company available in their zip code. More on the Part C trial right, Medicare Advantage. Medigap policies are no longer permitted to offer prescription drug coverage, even if previously included. Enrollment in a standalone Part D plan may be available. If a beneficiary joins a Medicare Advantage plan when first eligible for Medicare, they can choose from any Medigap policy within the first year. Some states provide additional special rights, like we talked about in New York. For more on guaranteed issue and trial rights, this article below here from Medicare.gov is a great resource. Medicare and Medicaid plan options. Anyone who's watching daytime TV often sees, do you have Medicare and Medicaid? And why is it such a push for Medicare and Medicaid? Well, we talked about that $850 rough amount, and that can be varied based on star rating. And also if you have certain health conditions, but also if you have Medicaid involved in there, that $850 is more like $1,600 a month. So the carriers get a lot more money when you have Medicare, Medicaid, and hence this is why you see benefits such as paying your electric bill and things like that. The income limit is very, very low, and even just having Medicaid is not enough. Often for the best plans, you have to be what's called a QMB plus, Qualified Medicaid Beneficiary Plus. There's different levels of Medicaid. Medicaid provides health coverage to millions of Americans, including eligible low-income individuals. Medicaid is administered by states and funded jointly by state and federal governments. Insurance carriers offer those with Medicare and Medicaid eligibility Medicare Advantage plans called dual special needs plans, or as we call them, DSNPs, with network options and extra benefits. These plans have governance over who can apply, when they can apply, and how often they can switch plans. Aside from the annual enrollment period and special enrollment periods, DSNPs can also be changed once per quarter, except for the fourth quarter. And there are new rules that need to be discussed as well. Elaborating more on Medicare and Medicaid. It used to be that you could change your dual SNP plan any time of year. Then it became once per quarter. And then in 2025, integration came out. So after March 31st, only companies that have, so I'm going to use Pennsylvania as an example. We have 4 companies right now in Pennsylvania: Aetna, PA Health and Wellness, which is Centene WellCare. So that's number 2. Number 3, UPMC. And number 4 being Keystone VIP or AmeriHealth VIP Caritas. So those 4 companies are the companies who currently offer Medicaid at a certain level. And in order to change after March 31st, then your Medicare and your Medicaid need to be aligned. If you wanted to switch to Aetna, but your Medicaid is with Keystone, then you would have to switch your Medicaid to Aetna to then be able to switch your Medicare plan, your dual plan, to that. So integration is big. In their way, it's a way of kind of making things easier, because having Medicare and Medicaid can often be confusing, especially if you don't qualify for a DSNP plan. You need to show them both cards. Why would you need a D-SNP plan anyway? Often Medicaid's going to pay what Medicare doesn't, so why would you even need a plan in the first place? Well, as I said, presenting both cards places, if you forget, then you get a bill of the 20% of Medicare, or if a doctor doesn't take Medicaid, now you're looking at the 20% of Medicare. The dual plan offers a network. Now you can go to a doctor that accepts a network who maybe didn't accept Medicaid before. And in theory, although I always recommend you show both cards, your Medicaid card and your Medicare Advantage or your Medicare red, white, and blue card if you don't have an Advantage plan to all your doctors, it's supposed to be a lot more seamless, and that's hence integration. What are chronic condition special need plans? Chronic condition special need plans, C-SNPs, restrict enrollment to individuals with specified severe or disabling chronic conditions. Chronic conditions require coordination of primary care physicians, specialists, and mental health providers, including inpatient and outpatient facilities. Often extensive ancillary services, diagnostic testing, and therapeutics are required. One or more comorbid and medically complex chronic conditions which are disabling or life-threatening. C-SNP availability is limited or absent depending on an individual's geographical location. If you have that condition, you apply for the plan. It can be done any time of year, once per year, if you haven't used it yet, outside the AEP or the OEP. This is another reason to be able to buy a plan. You would enroll in the plan, and notice would go to your doctor to prove that within 60 days you had that condition. If you did not have that condition, you would be disenrolled from the plan and given an opportunity to buy another Medicare Advantage plan. Institution special needs plans. Institution special need plans, known as I-SNPs, are designed for Medicare beneficiaries who for 90 days or longer have or expected to need the services of a long-term care, skilled nursing facility, or other eligible institution. Certain I-SNP plans that operate single or multiple facilities can establish county-based service areas if there exists at least one LTC facility that is accepting enrollments and is accessible to county residents. What is this? You live in a facility, the facility offers a plan. Sometimes you see these, United has them called Erickson. So you live in an Erickson facility, they have a plan that's specific to that facility, but often is a PPO and offers benefits outside of it, the benefits being better inside the facility than outside the facility. And the arrangement with that is usually that the carrier is sharing the money they're getting from Medicare with the plan. And if the members do end up in the hospital, the facility is also partially responsible for that cost. In an Erickson arrangement, United Healthcare is getting $850 and maybe paying half or 70% or whatever it is to the facility for this plan. And if the residents end up in the hospital, then the facility is financially responsible for helping to pay that. Special enrollment periods. What if you're outside of AEP, OEP, and do not qualify for D-SNP, SNP, or I-SNP? There are many different special enrollment periods that exist, which allow an eligible individual experiencing a qualified life event to enroll or change their Medicare options. Usually the enrollment must occur within 60 days of the qualified life event. Examples include loss of employer or union coverage, LEC, gaining or losing eligibility from LIS extra help, moving in or out of a planned service area, natural disasters, and many more. Refer to this link from Medicare.gov for more on Medicare savings accounts known as MSA. Similar to an HSA, compared to health savings account, HSA, Medicare savings accounts, MSAs, are designed to work for Medicare beneficiaries. A MSA is a Medicare Advantage plan with a high deductible with little to no coverage prior to satisfying that deductible. Unlike private HSA plans, MSA plans deposit money into the qualified individual's qualified bank account to use for medical expenses. MSA plans do not cover Part D, and therefore an additional standalone Part D prescription plan will in most cases be needed. Plan benefits, deductibles, enrollment periods, and other nuances are different from typical Medicare Advantage plans. I don't see a lot of MSAs anymore. There was a company called Lasso who got bought by a company called Zing that had these plans, and currently I haven't seen any. But for those with HSAs, typically an HSA has to have a high deductible plan. And once you go on Medicare, you really can't contribute to that HSA account anymore, but it can still incur interest and you can still use it for medical expenses, but you cannot add to it anymore after you go on Medicare. What are private fee-for-service and cost plans? Private fee-for-service are a type of Medicare Advantage plan. Unlike traditional Medicare Advantage and Medigap policies, PFFS determines how much it will pay providers and how much the member will pay when receiving care. They may or may not offer Part D coverages. Standard-alone Part D plans can be purchased if not provided. Members should make sure providers agree to treat under the plan and accept the plan's payment terms before services are rendered. That doctor can choose even in the middle of the year to not accept the plan terms anymore, so that it's good to know that about that. Medicare cost plans are available in limited areas of the U.S. Enrollment is allowed whenever the plan is accepting new members. Members can leave anytime to return to original Medicare and are permitted to purchase a separate Part D prescription drug plan, even when the plan has drug coverage. Individuals with Part B only may join, and those with Part A and Part B are covered under original Medicare when seen by a non-network provider. Members will pay the Part A and Part B coinsurance and deductible. Medicare cost plans are different from private fee-for-service. Are you happy with your current coverage? If you or your spouse work for an employer that has more than 20 employees, you can wait until retirement, separation, loss of coverage to enroll in Part B. Employer coverage is primary and the Medicare is secondary. The 20 employees is important. If you work for a company that is under 20 employees, Medicare is the primary payer and the plan is the secondary payer. Medicare wants you to have Part B, and if you don't, there can be problems. If it's over 20 employees, then the plan is primary and Medicare is secondary, and it is optional if you want to take Part B or not. That being said, you should still check with the work coverage or the union because they may want you to have Part B. Some do. If you or your spouse work for an employer that has less than 20 employees, it may be necessary to enroll in Part B as Medicare is the primary payer and employer coverage is secondary. There could also arise an access to care issue if not enrolled in Medicare A and B, which we just went over. If you are currently covered by the federally facilitated insurance marketplace or a state-based health insurance exchange such as Penny or Get Covered New Jersey or Cobra, the rules can get complicated. Refer to this for more guidance. I should add, Cobra is not credible coverage, and if you go more than 63 days on Cobra, you will usually incur Part B penalties. Part B late enrollment penalties. Medicare Part B late enrollment penalty, 10% penalty for each full year of delayed enrollment. Added to monthly Part B premium. Exceptions exist, such as having credible health insurance coverage during the delay period. Those with credible employer coverage. If you have employer-sponsored health insurance with Part B, you have an 8-month period to enroll in Medicare Part B without a late enrollment penalty. You have 8 months from the month your employment ends or your employer-sponsored health insurance coverage ends. If you don't have employer-sponsored health insurance with Part B, you have a 3 months to enroll in Medicare Part B without a late enrollment penalty. You have 3 months from the month you turn 65. Contact Social Security for more information and assistance regarding when to delay or enroll in Part B. I always recommend that you communicate with Social Security, Medicare, what your intentions are, whether you wish to continue working and delay your Part B or not. So at least it's on record that you have credible coverage. And upon retiring, there is a form out there that you need to get filled out and usually have signed by your employer stating that you had credible coverage. Part D late enrollment penalties. Maintaining Medicare CMS credible prescription drug coverage is mandatory, ensuring no coverage gap exceeds 63 days. Failure to meet this requirement typically results in the enforcement of a late enrollment penalty. To calculate this penalty, use the following formula. Number of full months without credible coverage times $38.99. I told you that number was coming back, times 1%. Example, 60 times $38.99 times 0.01 is $23.39. So in this case, you would be paying $23 in penalty for the rest of your life, regardless if it was a Medicare Advantage or a Part D plan. Say that you enroll with Aetna. The government tells Aetna you need to enforce $23.39 on top of the premium, whether it's an Advantage or Part D. And you say, I'm going to go to United Healthcare. The government then tells them to enforce that penalty. The government keeps track of these penalties and tells the insurance companies to enforce it if and when you go and buy drug coverage. This amount is added to your Part D and Part C plans that have drug coverage for the rest of your life unless paid by a federal or state program such as Medicaid or LIS. Is your mailbox full of flyers this time of year? If you're approaching 65 or already in that age bracket, you probably receive a lot of mail from solicitors. Solicitors are not permitted to call you regarding Medicare plans unless you have previously given permission by filling out a form online, through the mail, or in person at an event or retail kiosk. This is known as permission to contact. So just so you know, And they get smart with this. They can call you and ask if you're interested in dental or something like that and backdoor their way into talking about it. But they cannot call you and talk to you about Medicare Advantage or Part D plans without your consent. And you can report them to the government if you so wish by calling 1-800-Medicare and reporting them. Important mail will come from Social Security Administration and Department of Health and Human Services or your carrier plans. There's a lot of tricky mail out there that makes it look like from the government. It usually is not. We can help you determine what is important mail and what is an advertisement, even if you're not our client. You can text or email us a picture of something you say, is this legitimate? 9 out of 10 times it's not. If you suspect fraud of any kind, you are encouraged to report it to Medicare. Simply call 1-800-Medicare. Ready to start the process. Steps to take to get the ball rolling. Register for Social Security or sign up for Medicare Parts A and B. You still go through Social Security for A and B even if you're not collecting it. Confirm your enrollment date. Talk to an AHIP CMS certified agent or broker who will help with the initial enrollment and will also be available for questions and help throughout the year. Review and enroll in a supplemental policy or Medicare Advantage plan. Review and enroll in a prescription plan if not provided elsewhere. Important decisions. Once enrolled in Medicare, you will be in your initial election period, your IEP, 6 months from the effective date of your Medicare Part B to enroll in a Medigap policy. During your IEP, there is no medical underwriting for a Medigap policy, no health questions. Medicare beneficiaries with pre-existing conditions can benefit from a Medigap policy. Important factors to consider when comparing Medicare plan options: age, financial situation, health, providers, medications, and pharmacies utilized. How does Medicare coordinate with Social Security? Medicare Part B costs, income-related adjustments. If you have any questions at all, here's my contact information. doitformeinsurance.com/Medicare. Here's my number, and this is my email. Please like, comment, share. Thank you very much for joining us for this presentation. Please feel free to contact me at your leisure. Take care.